Class, so we're going into our last couple of systems as far as with pathophysiology class. So now we're on the urinary system. So just some terminology. The first about incontinence and retention. So incontinence is the voluntary loss of voluntary control of the bladder. Enuresis is involuntary urination by a child older than 4 years old, often related to some kind of developmental delays, some sleep patterns, or psychosocial aspect. Stress incontinence is more common in women after pregnancy. There is increased intra-abdominal forces increased intra-abdominal pressure forces urine through the sphincter. This is common with coughing, lifting, laughing, so that pressure pushes on the bladder and it forces out some urine, and it's also when there have been multiple pregnancies, that's more likely. That's stress incontinence. Overflow incontinence is due to an incompetent bladder sphincter, so the sphincter is not doing what it's supposed to do. In older adults, it may come from the weakened detrusor muscle, may not be able to, that's the muscle that surrounds the bladder and squeezes the urine out. If it's weakened, it can't empty out all the bladder. And so it increases the frequency of and that sensation of always having to go, and also incontinence. So it's incomplete emptying of the bladder. Also, overflow incontinence is involved in spinal cord injuries or brain damage, and it's called one type is neurogenic bladder, which can be spastic, which means the bladder is contracted all the time, or it can be it's flaccid and it's very relaxed and it's filled up. Any kind of interference with the signals between the central nervous system and the autonomic nervous system controls can inhibit the functioning of the bladder. Retention is the inability to empty the bladder, so unable to get all of it out. It may be accompanied by overflow incontinence if it completely fills up, or fills up too much, and it's retained. Spinal cord injury around the sacral level, because that's where the maturation reflex is located, and it also can come with anesthesia, can lead to this. Dialysis is a type of procedure that allows for filtration and reabsorption of fluids during when there's kidney damage. There are two forms of dialysis. There's hemodialysis and peritoneal dialysis. Hemodialysis is where the blood is filtered. Peritoneal dialysis is where fluid is pumped into the peritoneal cavity, the abdominal pelvic cavity, and the fluid is filtered through those membranes. This helps sustain life during kidney failure, and it's used to treat patients with acute and chronic kidney failure. With acute, you're going to try to use it until the primary problem is reversed, or until an edge stage renal failure is for when the kidney transplant, until a kidney transplant becomes available and is successful. So it's just going to sustain life until we can get some kidneys. Kidneys to heal or to be replaced. So the concept of dialysis is the blood enters in, okay, and diastolate is the fluid, and it has a buffer in it, okay, and so we're going to try to get rid of the waste, the acid, and those types of things. And so it's going to go until it reaches equilibrium, so the water is going to go out too. And then the blood goes back out, and it's got rid of some of the waste products. So this is a process, like I said, of reaching equilibrium and getting rid of those waste products, the nitrogen acids, nitrogen waste and acids. And it's going to use that semi-permeable membrane. The first type of urinary problem we're going to talk about is UTIs, urinary tract infections. These are very common infections because urine is an excellent growth medium. And we don't have anything really to fight inside our urine, fight off any infections. Lower urinary tract infections include cystitis, which is a bladder infection, and urethritis, which is the inflammation of the urethra. Upper urinary tract infections are kidney infections or pyelonephritis, and the most common causative organism is Escherichia coli, which is E. coli. There are a lot of other species that can be associated with urinary tract infections. Lots of different types of bacteria. As you can see here, there's Pseudomonas, Siderobacter, Enterobacter, Staphylococcus, Chlamydia, Mycoplasma. So there's a whole host of them, but the most common is really E. coli. They're more common in women because of the shortness of the urethra compared to men's, and also the proximity to the anus, which we know the large intestines is full of bacteria, and feces also has bacteria. Also common in older men because of urine retention and the prostatic hypertrophy, and so that's going to cause the retention and more likely to be more almost like stagnant in men. Also common in congenital abnormalities in children, so if there's some kind of abnormality in the urinary tract. Other common predisposing factors include incontinence, retention of the urine, and direct contamination with fecal material. So causes of urinary tract infection, as we look at this diagram, we can see there are some kind of inflammation or trauma of the mucosa down here. So the E. coli will then travel up the urethra into the urinary bladder, and then it ascends up into the colon. Okay, up into the colon. I mean, not the colon. Up into the other ureter, into the kidney. Okay, so we can see things like obstruction can cause that urine to stay in the kidney, so that's with prostatic hypertrophy. And then there also can be some reflux, and the urine actually goes backwards because of a defective valve. And we can see it spreads up into the kidney, and then we can see this purulent exudate, which is common in pyelonephritis. And we can see here, we can see the stasis of the urine. If there's some kind of immobility, can be more susceptible for the infection directly into the kidney, so the urine is getting kind of stayed in here. And then also it can come from the bloodstream, with septicemia. Cystitis and urethritis. Cystitis is the bladder wall is inflamed. Urethritis is the urethra is inflamed. Some of the symptoms are a hyperactive bladder and reduced capacity. There's usually pain in the pelvic region, accompanied by dysuria, urgency, frequency, and nocturia. So you wake up also at the middle of the night. Systemic signs may be also present, where there's fever and malaise, nausea, and leukocytosis, which is high white blood cell count. The urine often looks cloudy with unusual odor. If the urinalysis can sometimes indicate bacteremia, bacteria in the urine, pyuria, which is pus, and microscopic hematuria, which is blood, hidden blood, small blood in the urine. Pyelonephritis is infection of the kidney. It has all the signs of cystitis, but also includes flank pain in the lower back. It also may include a higher systemic temperature. The urinalysis looks similar to cystitis, but there may be urinary casts present from the renal tubule involvement. This is treated with antibacterials. This is an inflammatory disorder, so this is one type of inflammatory disorder of the kidney. It's called glomerulonephritis. This is due to inflammation response in the kidney from a specific, one type is there's many forms, but one type is caused by antibodies, anti-streptococcal antibodies. These antibodies are made in response to Streptococcus bacteria. Okay, and what they do is form the antigen-antibody complex. If my memory serves right, that's a type 3 immune hypersensitivity, and this is going to cause a activation of the complement system, and that complement system gets activated, and this is an immune response system, and this causes extreme inflammation of the glomerulus. And since the glomerulus are what filters the blood, what we see with this extreme inflammation is it makes it even more permeable. And so we're going to see a leakage from the bloodstream, the glomerulus, into the renal tubule, specifically the glomerular capsule, if you think about your anatomy of the nephron. So it goes from the glomerulus into the glomerular capsule, and it's going to link all this amount of protein and a large number of erythrocytes. So a lot of blood and a lot of protein. This can lead to a very severe inflammatory response and can cause congestion and cellular proliferation in the renal tubules. And since all this buildup, if it's very severe, then we're going to see it's going to actually swell up so much, and the cells are going to start dividing. It's going to really be funky, and it actually can lead to decreased glomerular filtration rate, and where the kidneys aren't even filtering the blood like they should, and causes us to retain fluid and waste. So early on, we can see lots of leakage of some protein, lots of erythrocytes. The urine can actually be like I think it's frothy. So how do we treat it? We can do sodium restriction as possible. If you remember, sodium gets reabsorbed. Protein and fluid intake decreased in severe cases, so we're going to try to reduce that loss of protein and fluid and give the kidneys time enough to heal. Drug treatment is going to be glucocorticoids to reduce inflammation, and since the kidneys are so tied to the blood pressure and the cardiovascular system, we can give antihypertensives to help lower blood pressure. Another type of inflammatory disorder is called nephrotic syndrome. The O helps me remember proteins. This is where we have, again, increased permeability, but this time we see large amounts of protein. So O means protein, that's how I remember it. Large amounts of plasma proteins escape into the filtrate. Sometimes we see it in children, and it's idiopathic between the years of 2 and 6. And then in other cases, we may see it secondary to systemic lupus erythematosus. Okay, and also to exposure to nephrotoxins, which are or drugs. So some toxins and drugs can also cause this nephrotic syndrome. Signs include large amounts of protein in the urine, proteinuria. You can also see some lipids and some cast. There's massive edema in the body, which is systemic edema. Sudden increase in girth. This is primary in children. Treatment includes glucocorticoids to reduce inflammation. ACE inhibitors may decrease protein loss in the urine, and then antihypertensives lower blood pressure, and sodium intake may also be restricted. Okay, it's going to help lower blood pressure. Urinary tract obstructions. These are our calculi or urolithiasis, kidney stones. They can develop anywhere in the urinary tract. They can be small or large. They tend to form because there's excess amounts of solutes in the filtrate. So solutes typically, are dissolved in the fluid, but if they get really concentrated, then they can crystallize out. So excessive amounts of solids can cause this. Insufficient fluid intake and also urinary tract infection. The manifestations only occur when there's obstruction of urinary flow, so only when we get backed up flow, so it blocks it. When we do have obstructions, this can lead to infection. It also can cause hydronephrosis of the kidney with dilation of the calces inside of the kidney, where the fluid is backed up and it swells inside the kidney. If located in the kidney or ureter, it can cause atrophy of the renal tissue. So this is hydronephrosis. We can see here is a calci here, and there's also some here, and what it does is it causes the urine to fill the calci, and what we see is the tissue actually atrophies as the pressure builds up and the urine builds up inside the kidney. Okay, and then this can also build up here and push back in. You can see these big pits where it's kind of destroyed the kidney with the urine pressure building up. Okay, calculi are commonly composed of calcium salts. This is usually with the high urine calcium levels, and forms with highly alkaline urine. So the urine is kind of alkaline, which is the opposite of acidic. So a high pH. Uric acid stones form usually with hyperuricemia, which is going to be where we have high levels of uric acid, and it's common in people who have gout, high purine diets, and those undergoing cancer chemotherapy. These are more typically with acidic urine. So if somebody has gout, you may see uric acid stones. There are struvite and cystine stones can also form, and the stone formation really depends on the predisposing factors, whether it will form or not. Hydronephrosis is a secondary problem caused by obstruction of the urinary tract. So calculi, tumors, scar tissues, enlarged prostate, anything that obstructs the urine flow. Often asymptomatic until the urine flow stops, and then it's going to build up inside the kidney, and then it pushes pressure on the atrophy of the renal tissue. Can be diagnosed with like ultrasounds, radionucleotide images, CTs, renal scans. If the cause is not removed, it can lead to chronic renal failure. Tumors of the kidney. One type is primary tumor is renal cell carcinoma. This is a primary kidney carcinoma. It arises in the tubule epithelial, most often in the renal cortex. So if you think back to your renal cortex, which is the glomerulus and the glomerular capsule, this is where it most likely arises. It tends to be symptomatic in the early stages, but often has metatastasized to other locations. So it starts in the kidney, and then it spreads to other locations such as liver, lungs, bones, or CNS at the time of diagnosis. It's more frequent in men and smokers. Treatment is removal of the kidney. Sometimes immunotherapy may be used. If the tumor is radio resistant, and chemotherapy is not used in most cases. The tumor is usually radio resistant. So chemotherapy is not used. You have to remove the kidney. Most bladder tumors are malignant and commonly arise from the transitional epithelial of the bladder. They're often developed as multiple tumors. Diagnosis includes the cytology of the urine and also biopsy. Early signs include things like hematuria, so you see blood in the urine, dysuria, and common infections. So just investigating those symptoms. The tumor is also invasive through the wall to adjacent structures, and they metastasize to the pelvic, lymph nodes, liver, and the bone. So it's a pretty malignant tumor if it arises in cancer. Some predisposing factors include working in chemical laboratories in particular industries, such as the ones that work with dyes, rubber, or aluminum, cigarette smoking, and recurrent urinary tract infections, heavy intake of analgesics or pain medications. Treatment includes surgical resection of the tumor, so removing the tumor, along with chemotherapy and radiation. Some photoradiation has been successful in some cases. So we talked about infections, inflammatory disorders, and tumors. Now we're going into vascular disorders, so nephrosclerosis. This is where the blood flow going to the kidney is damaged, often with, so it's atherosclerosis, similar to atherosclerosis, where there's a thickening and hardening of the walls of the arteries and the small arterioles and small arteries. These lead to reduced blood flow to the kidney, and since there's reduced blood flow, then they stimulate renin, and that increases the blood pressure because we think the blood pressure is dropping, but it's not. This leads to increased blood pressure, and it can also, the continued ischemia can cause more renin, and it kind of upcycles with hypertension and more ischemia, and until we reach the stage where we destroy the renal tissue and have chronic renal failure. And so this is like the vicious cycle of hypertension in the kidney. So let's start here with number one. Okay, so we have hypertension, and then that leads to decreased. So hypertension causes decreased blood to the nephrons. Okay, and so the decreased blood to the nephrons, and well, it's going to cause to stimulate the renal angiotensin model. So decreased blood to the nephrons causes the renal angiotensin model. This causes systemic vasoconstriction and also sodium and water retention. So as we have decreased blood flow, we have more sodium and water retention and more vasoconstriction. So the blood volume increases and we have higher blood pressure. So the increased blood pressure causes more hypertension. Okay, the hypertension then can cause damage to the arterioles. Okay, and then the hypertension, the systemic vasoconstriction, and the damage all causes more decreased blood flow. And so this keeps happening over and over and over. Okay, so the decreased blood flow eventually leads to ischemia, which is low oxygen to the tissues. The tissues die and have necrosis. Okay, then they scar over, which further causes problems with blood flow. More ischemia, and this cycles along until we get to the point where the kidney atrophies and has chronic renal failure. Hypertension is bad for your kidneys. That's why you need to, if you ever have any issues with hypertension, you make sure you treat them, because it can lead to chronic renal failure just by having high blood pressure. Okay. So just a little bit more on this nephrosclerosis, or this damage to the blood vessels, the nephrons. It can develop as a primary lesion in the kidney, so there can be a small sore lesion inside the kidney, and this causes damage to the blood flow. Or it can be secondary to essential hypertension, where we go in that cyclic pattern where the essential hypertension or high blood pressure is causing damage to the process in the kidneys. The treatment for nephrosclerosis includes antihypertensive drugs to lower blood pressure, diuretics to reduce water volume in the body, beta blockers, and sodium intake should be reduced. So it's all going to be about lowering that blood pressure. Let's stop right here.